Hey future RN, welcome to the next episode of our 1000 questions and answers series. In this video, we will delve into the most crucial NCLEX questions of the renal system. These questions have been previously asked in the NCLEX exam and are highly likely to be repeated in the next exam, so stay tuned till the end of the video. A 58-year-old man was recently diagnosed with end-stage renal disease, ESRD, secondary to chronic kidney failure. He has initiated hemodialysis treatment to manage his condition. Given the risk of disequilibrium syndrome in patients new to hemodialysis, the nurse diligently monitors John during his dialysis sessions for any signs or symptoms suggestive of this disequilibrium syndrome. A. Restlessness, irritability, and weakness. B. Elevated blood pressure, rapid heart rate, and fever. C. Headache, confusion and muscle twitching. D. Low blood pressure, slow heart rate, and decreased body temperature. The correct answer is C. Headache, confusion, and muscle twitching. During hemodialysis, patients newly diagnosed with chronic renal failure are at risk of developing disequilibrium syndrome due to rapid solute removal from the body. This syndrome primarily affects the central nervous system and can manifest with symptoms such as headache, confusion, and muscle twitching. These neurological symptoms occur as a result of osmotic changes in brain cells due to fluid shifts, leading to brain swelling and dysfunction. It is essential for nurses to assess for these specific neurological manifestations during dialysis sessions to promptly recognize and manage disequilibrium syndrome. Other symptoms such as restlessness, irritability, and weakness are less indicative of disequilibrium syndrome and may indicate other conditions or complications. What clinical manifestations would you anticipate observing in a patient presenting with acute pyelonephritis? A. Tenderness at the junction of the ribs and spine and sudden bouts of shivering. B. Discomfort or pain during urination with a sensation of burning. C. Yellowing of the skin and pain in the side of the torso, flank pain. D. Increased frequency of urination and waking up at night to urinate. Correct answer is A. Tenderness at the junction of the ribs and spine, costovertebral angle tenderness, and sudden bouts of shivering or chills. When considering the symptoms indicative of acute pyelonephritis, it's crucial to discern the distinct clinical manifestations that differentiate it from other conditions. Acute pyelonephritis, a severe bacterial infection of the kidneys, often presents with specific signs that aid in its diagnosis. One hallmark symptom is tenderness at the costovertebral angle, which refers to the point where the ribs meet the spine. This tenderness is typically elicited upon palpation and is indicative of inflammation and irritation in the kidneys. Additionally, patients with acute pyelonephritis commonly experience sudden episodes of shivering, known as chills, which can accompany fever and indicate systemic involvement. Conversely, options such as jaundice, characterized by yellowing of the skin, typically point toward issues related to the gallbladder or liver obstruction rather than kidney infection. Similarly, a burning sensation during urination, while suggestive of a urinary tract infection, is more indicative of lower urinary tract involvement, rather than the more severe kidney infection seen in pyelonephritis. Therefore, in the context of acute pyelonephritis, the presence of costovertebral angle tenderness and chills aligns with the expected clinical presentation, aiding in accurate diagnosis and timely management of this serious renal condition. What guidelines are included in the educational care plan for a patient with cystitis who is prescribed Phenazopyridine, Pyridium? A. Notify the healthcare provider if the urine changes color to orange-red. B. Take Phenazopyridine shortly before urination to alleviate pain. C. Upon relief from painful urination, discontinue the prescribed antibiotics. D. Cease Phenazopyridine intake once painful urination subsides. The correct answer is D. Cease Phenazopyridine intake once painful urination subsides. Phenazopyridine is administered to alleviate dysuria by providing analgesic and anesthesic effects on the urinary tract mucosa. The patient can discontinue its usage after the dysuria is relieved. The temporary change in urine color to red or orange is a common side effect due to the dye in the medication. Phenazopyridine is not meant to be taken immediately before voiding. Instead, it is typically taken 3 times daily for 2 days. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course, and for this month only. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations, but that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. Say farewell to monotonous study sessions and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. A female client is admitted for treatment of chronic renal failure, CRF, a condition characterized by the gradual loss of kidney function over time. As a nurse, you know that this disorder increases the client's risk of A. Metabolic alkalosis as a consequence of hydrogen ion retention. B. Increased serum calcium levels due to kidney failure. C. Retention of water and sodium due to a significant decrease in the glomerular filtration rate. D. Decreased serum phosphate levels stemming from kidney failure. Correct answer: C. Retention of water and sodium due to a significant decrease in the glomerular filtration rate. A patient with CRF faces the risk of fluid imbalance. Dehydration if the kidneys fail to concentrate urine, or fluid retention if the kidneys fail to produce urine. Electrolyte imbalances arise from the kidney's inability to excrete phosphorus, potentially leading to hyperphosphatemia and reciprocal hypocalcemia. CRF may result in metabolic acidosis, not metabolic alkalosis, due to the kidney's inability to excrete hydrogen ions. Miss Smith, a 55-year-old female, presents with complications related to uremia, necessitating renal replacement therapy. Due to difficulties encountered with hemodialysis, peritoneal dialysis has been initiated as the chosen mode of treatment. Which of the below given findings signals a significant problem during Miss Smith's peritoneal dialysis procedure? A. Hematocrit HCT of 34%. B. White blood cell WBC count of 22,000 per mm3. C. Potassium level of 3.5 MEq per liter. D. Blood glucose level of 210 mg per dl. The correct answer is B. White blood cell WBC count of 22,000 per mm3. An elevated WBC count suggests the presence of infection, likely arising from peritonitis. This complication may have been triggered by the insertion of the peritoneal catheter into the peritoneal cavity. Peritonitis can compromise the peritoneal membrane's ability to filter solutes, rendering the peritoneal dialysis ineffective as a treatment. While her HCT of 34% is slightly lower than normal, it is within an acceptable range given her regular blood sampling. Reduced HCT is common in patients with chronic renal failure due to erythropoietin deficiency. Which nursing intervention is most crucial for a male client in the oliguric phase of acute renal failure, ARF? A. Limiting fluid intake. B. Providing pain relief measures. C. Encouraging coughing and deep breathing. D. Promoting carbohydrate intake. The correct answer is A. Limiting fluid intake. During the oliguric phase of ARF, there is a significant decrease in urine output which can lead to fluid overload. Limiting oral and intravenous fluid intake is crucial to prevent complications such as heart failure and pulmonary edema. Providing pain relief measures is not a priority because ARF rarely causes pain. Encouraging coughing and deep breathing is important for clients with various respiratory disorders, but it is not the priority in ARF. Promoting carbohydrate intake may be helpful in ARF, but does not take precedence over fluid restriction. After undergoing a hemodialysis session, a client with chronic renal failure requires evaluation to ensure their stability post-treatment. Which of the following standard indicators should the nurse prioritize for assessing the client's condition after dialysis? A. Vital signs and weight. B. BUN and creatinine levels. C. Potassium level and weight. D. Vital signs and BUN. Correct answer: A. Vital signs and weight. Post-dialysis, monitoring the client's vital signs is crucial to ascertain their hemodynamic stability. Additionally, comparing the client's post-dialysis weight with their pre-dialysis weight is essential to evaluate the effectiveness of fluid removal. While laboratory studies such as potassium level, BUN, blood urea nitrogen, and creatinine levels are integral components of overall renal assessment, they are typically not immediately prioritized post-dialysis. In patients undergoing hemodialysis with a right arm fistula, there exists a risk of Steele syndrome, a vascular complication post-fistula creation. The nurse must assess for which clinical manifestations in these individuals: A. Parlor, diminished pulse, and pain in the right hand. B. Warmth, redness, and pain in the right hand. C. Edema and reddish discolorization of the right arm. D. Aching pain, parlor, and edema in the right arm. Correct answer: A. Parlor, diminished pulse, and pain in the right hand. Steele syndrome arises from compromised blood flow distal to the fistula, leading to parlor, a weakened pulse, and pain in the right hand due to tissue ischemia. A patient is hospitalized with an early-stage diagnosis of chronic renal failure. What should the nurse anticipate finding upon assessment of the patient? A. Increased urination, polyuria. B. Excessive thirst, polydipsia. C. Decreased urine output, oliguria. D. Absence of urine output, anuria. The correct answer is A. Increased urination. Polyuria is an early sign of chronic renal failure characterized by increased urine output. If left untreated, it can lead to severe dehydration. Polyuria may progress to oliguria and eventually anuria, where the patient loses all normal kidney functions. Let's move on to the next NCLEX questions and answers. A patient presents with severe flank and abdominal pain. An abdominal X-ray confirms the presence of urinary calculi. Which of the following interventions is important? A. Enforce strict bed rests to alleviate discomfort. B. Strain all urine for calculi and send it to the lab for analysis. C. Limit fluid intake to reduce pressure on the kidneys. D. Encourage a high calcium diet to counteract calcium loss. Correct answer is B. Strain all urine for calculi and send it to the lab for analysis. Confirming urinary calculi through an abdominal X-ray is crucial in cases of severe flank and abdominal pain. Subsequently, straining urine for analysis is essential. This process helps determine stone composition, guiding treatment effectively. Limiting fluid intake risks impeding stone expulsion, while a strict bed rest and a high calcium diet offer limited benefits and potential drawbacks. Therefore, prioritizing urine straining ensures precise diagnosis and optimal patient care. A patient is undergoing radiation implantation as part of their bladder cancer treatment. What intervention is most appropriate to manage their care effectively? A. Encourage the patient to limit their fluid intake. B. Dispose of all urine in a designated container. C. Closely monitor the patient for signs and symptoms of cystitis. D. Arrange for the patient to stay in a private room. Correct answer: C. Closely monitor the patient for signs and symptoms of cystitis. Cystitis, characterized by symptoms such as dysuria, frequency, urgency, and nocturia, is a common adverse reaction in patients undergoing radiation therapy for bladder cancer. Patients with radiation implants should be provided with a private room to ensure privacy and minimize exposure to others. Urine from such patients should be directed to the radioisotopes lab for monitoring. It is advisable to encourage adequate fluid intake to promote hydration and aid in the elimination of radioactive substances. Ready for the next question? Here's another NCLEX questions and answers. Following a renal transplant, a patient begins cyclosporine therapy to prevent graft rejection. Which of the following complications is most concerning with this medication? A. Gastric mucosal injury. B. Infection. C. Depression. D. Hemorrhage. The correct answer is B. Infection. Infection is a significant concern with cyclosporine therapy due to its immunosuppressive effects. While depression may occur post-transplant, it's not directly associated with cyclosporine. Gastric mucosal injury is more commonly linked to steroid therapy, and hemorrhage is a complication of anticoagulant therapy. What medication instruction should a nurse provide to a male client prescribed co-trimoxazole, trimethoprim sulfamethoxazole, for a urinary tract infection? A. Avoid taking antacids during co-trimoxazole therapy. B. Take the medication with food. C. Drink at least 8 10-ounce glasses of fluid daily. D. Don't be afraid to go out in the sun. The correct answer is C. Drink at least 8 10-ounce glasses of fluid daily. Sulfonamides, like co-trimoxazole, can increase the risk of crystalluria or tubular deposits if urine output is insufficient. Adequate hydration helps prevent these complications by promoting sufficient urine flow, which aids in flushing out potential harmful substances. Therefore, advising the client to maintain proper hydration is essential for promoting urinary tract health and minimizing the risk of complications associated with co-trimoxazole therapy. Which hallmark manifestation of abrupt onset acute glomerulonephritis does Nurse Smiley identify during the initial evaluation of a male client undergoing treatment? A. Urine tinged with a green hue. B. Widespread swelling, particularly noticeable in facial and periorbital regions. C. Excessive urination. D. Significant drop in blood pressure. Correct answer? B. Widespread swelling, particularly noticeable in facial and periorbital regions. The characteristic symptom of acute glomerulonephritis is generalized edema, notably prominent in the facial and periorbital areas. Other typical indicators of this condition encompass hematuria, proteinuria, fever, chills, weakness, pallor, loss of appetite, nausea, and vomiting. Hypertension, reduced urine output, and abdominal or flank discomfort are also frequently observed. Now, let's dive into the next NCLEX questions and answers. What is the appropriate method for a nurse to collect a urine specimen for culture and sensitivity from a female client suspected of having a urinary tract infection? A. Detach the tubing from the urinary catheter and allow urine to flow into a sterile container. B. Cleaning the self-sealing aspiration port with antiseptic solution and extracting urine using a sterile needle. C. Emptying urine from the drainage bag into a sterile container. D. Securing the tubing with a clamp for 40 minutes and using a sterile needle to draw urine from above the clamp. Correct answer is B. Cleaning the self-sealing aspiration port with antiseptic solution and extracting urine using a sterile needle. Most catheters feature a self-sealing port designed for obtaining urine specimens. Cleaning this port with antiseptic solution helps minimize the risk of introducing microorganisms. Option A involves disconnecting the tube, which could introduce contaminants. Option B may yield urine that is not fresh and may contain bacteria, leading to inaccurate results. Option D suggests clamping the tube, which is unnecessary and may disrupt urine flow. During the assessment of a male client diagnosed with gonorrhea, what symptom is most likely to have driven the client to seek medical attention? A. Presence of rashes on the palms of the hands and soles of the feet. B. Development of cauliflower-like warts on the penis. C. Occurrence of painful red papules on the shaft of the penis. D. Appearance of a foul-smelling discharge from the penis. Correct answer is D. Appearance of a foul-smelling discharge from the penis. Men with gonorrhea typically seek medical attention due to a foul-smelling discharge from the penis and experience pain during urination. This discharge is often purulent and indicates an infection of the urethra. Option A, presence of rashes is a characteristic of the secondary stage of syphilis. Option B, development of cauliflower-like warts suggests human papillomavirus infection. Option C, occurrence of painful red papules may indicate the first stage of genital herpes. While attending to a male patient diagnosed with acute renal failure, ARF, a nurse anticipates the need to modify the dosage or timing of administration for specific medications. Which of the following medications would not necessitate such alterations? A. Vancomycin. B. Ticarcillin disodium. C. Cyclosporine. D. Paracetamol. Correct answer is D. Paracetamol. Paracetamol is metabolized in the liver, and thus its dosage and dosing schedule need not be adjusted for a client with ARF. On the other hand, vancomycin and ticarcillin, as mentioned in the question, require dosage and schedule adjustments as they are metabolized and excreted by the kidney. Additionally, while cyclosporine may cause nephrotoxicity, the nurse must monitor both the dosage and blood drug level in a client receiving this drug. 2 months after undergoing a kidney transplant, a patient is admitted to the hospital with a diagnosis of acute rejection. Which of the following assessment findings would be anticipated? A. Hypotension. B. Normothermia. C. Reduced white blood cell count. D. Elevated blood urea nitrogen and creatinine levels. The correct answer is D. Elevated BUN and creatinine levels. In a patient experiencing acute renal graft rejection, signs of declining renal function are expected. Acute rejection is one of the types of renal transplant rejection. There are 3 types of rejection. 1. Hyperacute rejection occurs a few minutes after the transplant when the antigens are completely unmatched. The tissue must be removed immediately to prevent the recipient from dying. 2. Acute rejection may occur anytime from the first week after the transplant to 3 months afterward. All recipients experience some degree of acute rejection. And 3. Chronic rejection can occur over many years. The body's constant immune response against the new organ gradually damages the transplanted tissues or organ. The patient may exhibit acute hypertension rather than hypotension. Elevated white blood cell counts and fever are typically due to the body's recognition of the graft as foreign, prompting an immune response. Therefore, monitoring for elevated BUN and creatinine levels is crucial for identifying acute rejection, which is a form of renal transplant rejection. Before undergoing kidney transplantation with a living donor, what crucial preoperative assessment must be conducted? A. Evaluation of urine output. B. Observing for indications of graft rejection. C. Recognition of signs and symptoms of rejection. D. Assessing the patient's support system and understanding of lifestyle modifications. Correct answer, D. Assessing the patient's support system and understanding of lifestyle modifications. Before kidney transplantation, it is critical to assess the patient's support system and their comprehension of necessary lifestyle changes. Post-transplantation, the patient will necessitate diligent follow-up care and adherence to medical protocols. While monitoring urine output post-operatively is important to ensure optimal kidney function, pre-operatively, the patient may experience limited urine production. Likewise, observing for signs and symptoms of infection is crucial post-operatively due to immunosuppressive therapy, as rejection is a potential risk. Nevertheless, focusing on evaluating the patient's support network and their understanding of lifestyle adjustments is paramount for achieving positive post-transplant outcomes. Following a transurethral prostatectomy for benign prostatic hypertrophy, a client is currently undergoing continuous bladder irrigation and reports an escalation in the severity of bladder spasms. What action should be taken first? A. Cease bladder irrigation and notify the physician. B. Assess for the presence of clots and confirm adequate catheter drainage. C. Administer acetaminophen. D. Provide an indomethacin suppository as per physician's orders. The correct answer, B. Assess for the presence of clots and confirm adequate catheter drainage. Prior to addressing the increased bladder spasms, it is imperative to identify potential underlying causes. Option B entails checking for clots and ensuring proper catheter drainage, as clot formation or urinary flow obstruction can exacerbate spasms. Promptly addressing these issues can alleviate discomfort and mitigate complications. Options A, C, and D may offer relief for spasms, but they do not address the root cause. Therefore, the primary intervention is to assess for clots and confirm proper catheter drainage. Before we move forward, here's some exciting news. Our 100-hour animated NCLEX review course is now available at a whopping 70% discount for this month only. In the first 30 hours, we cover all essential NCLEX topics with engaging animations. Then, dive into 5,000 NCLEX questions all brought to life with dynamic animation. Plus, you'll get access to NGN questions, an ebook, mock tests, and more. Say goodbye to dull textbooks and hello to an interactive learning experience. Enroll now and secure your success with our animated NCLEX course. Click the link in the description box to get started. The nurse is caring for a patient with frequent urination, polyuria, and suspects they might have water diuresis, where excess water is excreted by the kidneys. To confirm this, the nurse checks what specific laboratory values which would indicate the presence of water diuresis. A. Elevated urine-specific gravity. B. Increased urine osmolarity. C. Normal to decreased urine-specific gravity. D. Heightened urine pH. Correct answer, C. Normal to decreased urine-specific gravity. Water diuresis is associated with a normal to decreased urine-specific gravity alongside low urine osmolarity and serum sodium level within the normal to elevated range. Elevated specific gravity typically signifies dehydration, while hypernatremia may indicate acidosis and shock. An elevated urine pH can result from factors such as potassium deficiency, a high-protein diet, or uncontrolled diabetes. Upon diagnosis of prostate cancer in a client, which test is used to track the advancement of the disease? A. Prostate-specific antigen, PSA. B. Complete blood cell count. C. Serum calcium. D. Serum creatinine. The correct answer, A. Prostate-specific antigen, or PSA. The PSA test is employed to monitor the progression of prostate cancer. Elevated PSA levels indicate a greater tumor burden. Option B, CBC, is utilized for diagnosing anemia and polycythemia. Option C, serum calcium levels are not typically used to monitor prostate cancer progression. Option D, serum creatinine levels may suggest obstruction due to an enlarged prostate. An individual aged 40 years who acquired paraplegia following a swimming mishap is now exhibiting symptoms of autonomic dysreflexia. What is the predominant factor triggering autonomic dysreflexia in this case? A. Respiratory infection in the upper tract. B. Loss of bladder control. C. Expansion of the bladder. D. Frequent bowel movements. The correct answer is C. Expansion of the bladder. Autonomic dysreflexia, a potentially severe complication of spinal cord injury, is frequently initiated by urinary system or bowel obstruction. While an upper respiratory infection can block the respiratory system, it does not impact the urinary or bowel system. Loss of bladder control and frequent bowel movements do not typically lead to obstruction in these systems. When providing discharge teaching for a client with uric acid calculi, which dietary instruction should the nurse emphasize avoiding? A. Low calcium. B. Low oxalate. C. High oxalate. D. High purine. Correct answer is D. High purine. To manage uric acid calculi, it's important for the client to adhere to a low purine diet, which excludes high purine foods such as organ meats. Option A, a low calcium diet, decreases the risk for oxalate renal calculi. Option B and C, oxalate is an essential amino acid and must be included in the diet. A low oxalate diet is used to control calcium or oxalate calculi. The patient afflicted with urolithiasis, who also presents a history of recurrent urinary tract infections, is likely to possess which category of urinary stones? A. Calcium oxalate. B. Uric acid. C. Struvite. D. Cysteine. Correct answer is C. Struvite. Struvite stones typically develop in urine with alkaline properties and high ammonia content, often linked with urinary tract infections. Option A, calcium oxalate stones arise due to heightened calcium intake or conditions elevating serum calcium levels. Option B, uric acid stones manifest in individuals suffering from gout. Option D, cystine stones are uncommon and occur in patients with a hereditary anomaly leading to reduced renal absorption of the amino acid cysteine. A nurse is devising discharge instructions for a patient recovering from sepsis originating from a urinary tract infection, UTI. What primary guidance should Nurse Jennifer include in the patient's discharge plan? A. Abstain from sexual activity. B. Employ cool baths for symptom management. C. Ensure a daily intake of 8 to 10 8-ounce glasses of water. D. Avoid the use of tampons during the recovery period. Correct answer, C. Ensuring a daily intake of 8 to 10 8-ounce glasses of water is crucial. Adequate hydration is pivotal in preventing UTI reoccurrence, especially following sepsis recovery. This practice aids in urine dilution and encourages frequent urination, effectively flushing bacteria from the urinary tract to prevent further infection. The nurse is attending to a patient diagnosed with acute renal failure who also presents with elevated blood pressure levels. The nurse aims to identify the primary factor contributing to hypertension in cases of acute renal failure. What is the most prevalent element leading to hypertension in such instances? A. Decreased levels of red blood cells. B. Excessive bodily fluid volume. C. Insufficient bodily fluid volume. D. Accumulation of fluid in the lungs. The correct answer is B. Excessive bodily fluid volume. Excessive bodily fluid volume is the main cause of hypertension in acute renal failure. In this scenario, the kidneys, responsible for regulating fluid balance, fail to adequately filter excess fluid and waste from the blood. Consequently, fluid accumulates, resulting in hypertension. Imagine the circulatory system akin to a plumbing system. The kidneys function as drains removing surplus water. If these drains malfunction, water accumulates in the pipes or blood vessels, elevating pressure. The nurse should focus on managing fluid overload, including administering diuretics as prescribed, monitoring fluid intake and output, and regularly assessing weight and blood pressure. Collaborative communication with healthcare providers ensures timely adjustments to treatment plans. The nurse is monitoring a patient in the post-operative period, 6 hours after a cholecystectomy, who has an indwelling urinary catheter. Initially devoid of urine, the catheter now exhibits only 100 milliliters of urine with no evident obstruction. What should be the nurse's primary action in this situation? A. Perform irrigation of the urinary catheter with sterile saline or water. B. Administer a 400 milliliter bolus of isotonic saline solution. C. Evaluate the patient's circulatory status and vital signs. D. Inform the surgical team. Correct option, C. Evaluate the patient's circulatory status and vital signs. Assessing the patient's circulatory status and vital signs is crucial. In the post-operative phase, a urine output of 100 milliliters over 6 hours raises concern for inadequate renal perfusion or the onset of acute kidney injury. Evaluating the patient's circulatory status and vital signs provides essential insights into their hemodynamic stability, shedding light on potential reasons for the low urine output. The nurse is attending to a patient with diabetes mellitus and undergoing hemodialysis for renal failure. What dietary advice would be most suitable for this patient during the intervals between dialysis sessions? A. Suggesting a diet moderately low in protein without specific guidelines on water intake. B. Advising a protein-restricted diet and the use of a prescribed salt substitute. C. Recommending a diet moderately low in protein along with managing water intake as directed by the healthcare provider. D. Indicating that no specific dietary limitations are necessary. Correct answer, C. Recommending a diet moderately low in protein along with managing water intake as directed by the healthcare provider. Patients with diabetes mellitus undergoing hemodialysis require careful dietary management to alleviate strain on the kidneys. A diet moderately low in protein is advised to reduce renal workload. Additionally, regulating water intake under healthcare provider guidance is essential to maintain fluid balance and prevent complications associated with fluid overload, common in hemodialysis patients. This advice ensures the patient's nutritional needs are met while minimizing renal stress. While caring for a patient who is currently experiencing oliguric renal failure, the nurse is curious about what expected level of 24-hour urine output for this patient. A. Below 100 milliliters. B. Less than 400 milliliters. C. Under 600 milliliters. D. Not exceeding 1200 milliliters. The correct answer is B. Less than 400 milliliters. The oliguric phase of renal failure is characterized by a significant reduction in urine output. The most common initial clinical manifestation of AKI is oliguria, defined as a reduction in urine output less than 400 milliliters per day. Oliguria is manifested within 1 to 7 days of kidney injury. This phase typically lasts 10 to 14 days, but can last months in some cases. In this phase, the kidneys are unable to adequately filter waste products and excess fluid from the blood, leading to a decrease in urine production. A 24-hour urine output of less than 400 milliliters is generally considered to be indicative of the oliguric phase. This low output can lead to fluid overload, electrolyte imbalances, and the accumulation of waste products in the body, all of which are serious concerns that require immediate medical attention. What is a common sign of a urinary tract infection, UTI, in a patient? A. Burning sensation during urination. B. Increased frequency of urination. C. Sweet odor coming from urine. D. Decreased urge to urinate. Correct answer? A. Burning sensation during urination. A burning sensation, medically known as dysuria, is a common sign of a urinary tract infection, UTI. This discomfort occurs due to inflammation and irritation of the urethra or bladder, typically caused by bacterial infection. Dysuria is one of the characteristic symptoms of a UTI and often prompts individuals to seek medical evaluation and treatment. Let's move on to another crucial NCLEX question and answers. What is the best method to check the patency of an arteriovenous fistula for hemodialysis? A. Check for any obstruction by drawing blood from the fistula using a needle and syringe. B. Assess the time it takes for the blood vessels in the nail bed of the same arm to refill after pressure is applied. C. Feel for gentle thrill along the entire length of the fistula. D. Apply pressure to the fistula and observe how quickly it refills with blood after being released. The correct answer is C. Feel for a continuous, gentle vibration along the entire length of the fistula. The most effective method for determining if an arteriovenous AV fistula is open for hemodialysis is to palpate it along its length to detect a continuous, gentle vibration known as a thrill. The presence of a thrill indicates sufficient blood flow through the fistula, which is vital for successful hemodialysis. A lack of this vibration could suggest potential issues, such as blood clotting or narrowing of the fistula, requiring prompt medical attention. A patient reports leaking urine whenever she coughs, sneezes, or lifts heavy items. What type of urinary incontinence is she likely experiencing? A. Reflex incontinence. B. Overflow incontinence. C. Stress incontinence. D. Urge incontinence. Correct answer is C. Stress incontinence. Stress incontinence is characterized by the involuntary loss of urine during physical activities that increase intra-abdominal pressure, such as coughing, sneezing, or lifting heavy objects. This type of incontinence is often caused by weakened pelvic floor muscles or a weakened urethral sphincter, which can occur due to factors like childbirth, aging, or surgery. Nurse Ethan should consider recommending pelvic floor exercises, such as Kegels, to strengthen the muscles that help control urination. Lifestyle modifications like weight loss and avoiding bladder irritants like caffeine and alcohol may also help. In some cases, surgical interventions like sling procedures may be considered. A nurse caring for a post-operative patient following pyeloplasty is watchful for signs of acute renal failure. Which symptoms should raise suspicion of acute renal failure in this patient? A. Urine output less than 400 milliliters in the last 24 hours. B. Nausea and vomiting. C. Frequent bowel movements. D. Complete absence of urine. Correct answer is A. Urine output less than 400 milliliters in the last 24 hours. Oliguria, or reduced urine output, is a key early indicator of acute renal failure. In the context of surgeries related to the renal system, such as pyeloplasty, oliguria could signify complications such as renal ischemia, post-operative edema, or surgical injury, necessitating prompt intervention. Now, shifting our focus to the next set of NCLEX review questions. While closely monitoring the cardiac status of a patient with end-stage renal disease, the nurse observes frequent PVCs, premature ventricular contractions, on the cardiac monitor. What should be the priority nursing intervention in this situation? A. Prepare for potential defibrillation. B. Administer intravenous diltiazem to the patient. C. Evaluate the latest lab findings regarding the patient's potassium levels. D. Promptly reach out to the healthcare provider for assistance. The correct answer is C. Evaluate the latest lab findings regarding the patient's potassium levels. The priority nursing intervention is to assess the patient's recent potassium levels. In individuals with end-stage renal disease, ESRD, frequent PVCs often signal hyperkalemia or elevated potassium levels. As the kidneys regulate potassium levels, dysfunction in ESRD can result in hyperkalemia, potentially leading to serious cardiac rhythm disturbances. Thus, it's crucial to examine the most recent laboratory results for the patient's potassium level to confirm or rule out hyperkalemia as the cause of the PVCs. What is the priority nursing diagnosis for a patient diagnosed with end-stage renal disease? A. Deficit in patient knowledge. B. Experience of pain. C. Excess fluid volume. D. Intolerance to physical activity. Correct answer. C. Excess fluid volume. The primary nursing diagnosis for a patient with end-stage renal disease is addressing excess fluid volume. In end-stage renal disease, ESRD, the kidneys lose their ability to effectively filter waste and excess fluids from the blood. This can lead to fluid and electrolyte imbalances, particularly excess fluid volume. Symptoms may include edema, hypertension, and potentially heart failure if not managed properly. Therefore, managing excess fluid volume is crucial in the care of patients with ESRD. Moving along, here's the next important NCLEX question for you. During hemodialysis treatment, what action should be taken to minimize complications associated with an arteriovenous fistula in the arm? A. Notify if bruit or thrills detected over fistula. B. Establish IV lines away from the fistula. C. Avoid measuring blood pressure on the fistula arm. D. Check pulses distal to the fistula site. Correct answer. C. Avoid measuring blood pressure on the fistula arm. Avoiding blood pressure measurements on the arm with the arteriovenous fistula is crucial to prevent complications like clot formation or vessel narrowing, which may compromise dialysis effectiveness and require surgical intervention. In the assessment process for potential transition to continuous periodontal dialysis, what fundamental requirement must a patient meet to be deemed eligible for this treatment approach? A. Full recovery of the patient's vascular access site. B. Presence of severe pulmonary edema. C. Maintenance of steady hemodynamic parameters. D. Documentation of unsuccessful hemodialysis attempts. Correct answer. C. Maintenance of steady hemodynamic parameters. Continuous periodontal dialysis, CPD, is frequently considered for patients with stable hemodynamic parameters. Unlike hemodialysis, which can induce rapid shifts in fluid and electrolytes potentially compromising cardiovascular stability, CPD is generally less disruptive to the circulatory system. Nevertheless, it remains essential for patients to possess stable hemodynamics beforehand, as any dialysis modality may exert some influence on fluid and electrolyte balance. A nurse is caring for a 50-year-old patient diagnosed with pyelonephritis and suspected septicemia. The patient has experienced recurring UTIs, suffering from sleep deprivation, and has experienced weight loss due to frequent urination, particularly at night. The patient's lab results show elevated sodium levels at 158 MEq per liter, osmolarity at 340 MOSM per liter, glucose at 129 mg per dl, and potassium at 3.8 MEq per liter. What is the foremost nursing concern for this patient? A. Altered nutrition due to increased metabolic activity. B. Fluid volume deficit due to inability to retain water. C. Altered nutrition due to insulin deficiency. D. Fluid volume deficit due to excessive urination. The correct answer is option B. Fluid volume deficit related to the body's inability to retain water. The patient's lab results indicate hypernatremia, high sodium levels, and elevated osmolarity, both indicative of dehydration or fluid volume deficit. Pyelonephritis, particularly when complicated by septicemia, intensifies the body's metabolic rate, exacerbating fluid loss. Additionally, frequent urination caused by recurring UTIs contributes to fluid depletion. In this scenario, the inability to retain water makes fluid volume deficit due to the body's inability to retain water the primary nursing concern. Let's transition to the next vital NCLEX review question. During peritoneal dialysis, the nurse notices that the return fluid is draining slower than usual. What should be the nurse's immediate action to address this issue? A. Adjust the patient's bed to a reverse Trendelenburg position. B. Inspect the outflow tubing for kinks or obstructions. C. Ask the patient to cough. D. Raise the drainage bag above the patient's abdomen. Correct answer is B. Inspect the outflow tubing for kinks or obstructions. When administering peritoneal dialysis, it's crucial to ensure proper drainage of the dialysate fluid. Slow drainage may result from various factors, but the most immediate concern is kinks or obstructions in the outflow tubing. Kinks can impede the flow volume, making it challenging for the dialysate to drain effectively. By examining and rectifying any kinks or obstructions in the tubing, the nurse can promptly resolve the issue without risking harm to the patient. The nurse is creating a care plan for a kidney transplant patient at risk for infection. Which goal is appropriate? A. Resume regular fluid intake within 48 to 72 hours. B. Maintain normal body temperature with infection-free cultures. C. Return to work within 2 to 3 weeks post-surgery. D. Gradually stop using cyclosporine as safely and quickly as possible. Correct answer is B. Maintain normal body temperature with infection-free cultures. Ensuring the patient maintains a typical body temperature and consistently tests negative for infections is crucial following a kidney transplant, especially when infection risk is a concern. This objective directly tackles the nursing diagnosis of risk for infection by setting clear parameters for success, such as monitoring body temperature and conducting culture tests, allowing for the evaluation of nursing intervention's efficacy. Next up, we'll tackle another significant NCLEX question and answers. A nurse is evaluating a patient who is experiencing severe discomfort on the left side of his lower back, along with nausea, vomiting, and restlessness. The patient exhibits pallor and sweating. His vital signs are BP 145/85 mmHg, pulse 112 beats per minute, respirations 30 breaths per minute, and temperature 97.0 degrees Fahrenheit. Considering the subjective data, which symptom most strongly indicates the likelihood of renal calculi? A. Previously encountering mild symptoms resembling the flu. B. Vomiting, characterized by a coffee ground appearance. C. Pain extending towards the left upper abdominal area. D. Urine that is both dark in color and produced in low amounts. Correct answer is D. Urine that is dark in color and produced in low amounts. The most suggestive symptom of renal calculi, or kidney stones, is the dark-colored urine produced in scant amounts. This indicates hematuria, blood in the urine, a typical sign of kidney stones. The reduced urine output may signify urinary tract obstruction, possibly due to a kidney stone. Additionally, the intense left-sided lower back pain, known as renal colic, further supports this diagnosis. A patient with renal failure requires medication intervention to manage complications. Which of the following best describes the primary purpose of administering polystyrene sulfonate, Kyaxylate? A. To correct disturbances in acid-base equilibrium. B. To exchange potassium ions with sodium ions. C. To reduce elevated levels of phosphate in the bloodstream. D. To alleviate constipation caused by sorbitol consumption. The correct answer is option B, to swap potassium ions for sodium ions. Polystyrene sulfonate kyaxylate primarily addresses hyperkalemia, an elevated potassium level in the blood, commonly observed in patients with renal failure due to impaired kidney function. By exchanging sodium ions for potassium ions in the intestines, kyaxylate facilitates the removal of excess potassium from the body through fecal excretion, mitigating the risk of cardiac arrhythmias associated with hyperkalemia. This option aligns with the medication's therapeutic mechanism and its targeted role in managing complications specific to renal failure, ensuring optimal patient care. In the care of a patient following a prostatectomy, which complication necessitates immediate and primary assessment? A. Early signs of pneumonia. B. Indicators of excessive bleeding or hemorrhage. C. Manifestations of urinary retention. D. Emergence of symptoms indicating deep vein thrombosis. The correct response is B. Indicators of excessive bleeding or hemorrhage. Following a prostatectomy, prompt identification of excessive bleeding or hemorrhage is paramount. Due to the prostate's significant vascularity, there exists a heightened risk of substantial blood loss post-surgery. Immediate and thorough assessment for signs such as abrupt hypotension, elevated heart rate, and diminished hemoglobin levels is essential. This proactive approach ensures timely intervention to avert further complications and stabilize the patient's post-operative condition. Continuing forward, here's the next critical NCLEX review question. During a continuing education seminar focused on preventing urinary tract infections, UTIs, in hospitalized patients, the speaker queries the audience about the primary factor contributing to the majority of UTIs in hospital settings. What is the most probable response? A. Inadequate perennial hygiene. B. Utilization of invasive procedures. C. Patient's immunosuppressed condition. D. Insufficient fluid intake. The correct answer is B. Utilization of invasive procedures. In hospital settings, the leading cause of urinary tract infections, UTIs, often stems from the utilization of invasive procedures, notably the insertion of urinary catheters. Catheterization can introduce bacteria into the urinary tract, circumventing the body's natural defense mechanisms against infection. This risk is exacerbated if catheter insertion lacks aseptic technique, maintenance is inadequate, or if catheters remain in place for prolonged durations. Although hospitals implement protocols to mitigate risks, such as restricting catheter usage to medically necessary cases and prompt removal, the risk remains significant. Understanding this primary factor underscores the importance of vigilant infection control practices to minimize UTI occurrences in hospitalized patients. Without delay, let's explore the next essential NCLEX question. What is the most frequently observed early sign of kidney disease? A. Blood in the urine. B. Elevated blood pressure. C. Excessive thirst and hunger. D. Proteinuria. Correct answer is D. Proteinuria. Proteinuria, characterized by an abnormal presence of protein in the urine, is frequently one of the earliest indicators of kidney disease. Normally, healthy kidneys filter waste while retaining essential substances like proteins. However, kidney damage compromises this function, causing proteins to leak into the urine. Proteinuria is often detected through routine urine tests, signaling various kidney diseases such as chronic kidney disease and glomerulonephritis. Recognizing this primary sign is vital for early detection and management of kidney-related conditions. Now, on to the next challenging NCLEX review question. What instruction should a nurse include in the patient's teaching plan to manage persistent itching and pruritus in a patient with chronic renal failure? A. Bathe regularly using gentle soap. B. Vigorously dry the itchy skin with a towel. C. Use moisturizing creams containing alcohol. D. Keep nails trimmed and clean. The correct answer is D. Keep nails trimmed and clean. Persistent itching or pruritus frequently occurs in individuals suffering from chronic renal failure. This itching typically results from the buildup of uremic toxins, dry skin, and occasionally elevated phosphorus levels. To effectively address this symptom, it is advisable to keep fingernails trimmed and hygienic. Lengthy or unclean nails may harbor harmful bacteria, heightening the likelihood of skin infections when scratching occurs. By maintaining short, well-maintained nails, the risk of such infections is mitigated, while also minimizing the potential for skin damage that can worsen the itching and contribute to additional complications, including infection or scarring. Without further ado, let's delve into the next crucial NCLEX question. During his rounds, the nurse attends to a patient recently diagnosed with acute pyelonephritis. Considering the diagnosis, which signs would the nurse anticipate observing in the patient? A. Burning sensation during urination. B. Increased frequency of urination and urination at night. C. Jaundice and pain in the flank area. D. Tenderness at the costrovertebral angle along with chills. Correct answer is D. Tenderness at the costrovertebral angle along with chills. Tenderness at the costrovertebral angle along with chills is characteristic of acute pyelonephritis, a bacterial kidney infection typically stemming from a lower urinary tract infection. This symptom, indicative of kidney involvement, manifests as sensitivity at the angle formed by the vertebral column and costal margin. Additionally, chills frequently accompany this condition, accompanied by fever, signaling the body's immune response to combat the infection. Next in line, we have another pivotal NCLEX question and answers. A 23-year-old male patient is admitted to the hospital presenting with dark urine, fever, and flank pain. After diagnostic tests, the patient is diagnosed with acute glomerulonephritis. What health history factor is most likely to be present in this patient's case? A. History of renal calculi. B. Previous renal trauma. C. Recent episode of sore throat. D. Family history of acute glomerulonephritis. The correct answer is C. Recent episode of sore throat. Acute glomerulonephritis often occurs as a post-infectious complication, frequently following a streptococcal infection such as sore throat or pharyngitis. The body's immune response to the infection can inadvertently cause infection to the glomeruli, the kidney's filtering units, leading to symptoms like dark urine, fever, and flank pain. Therefore, a recent episode of sore throat would be the most likely health history factor in this patient's case. Let's transition to the next vital NCLEX review question. A nurse is caring for a paraplegic patient who has been diagnosed with renal calculi. The nurse is trying to understand the contributing factors that led to the formation of these calculi. Which factor is likely to have contributed to the development of renal calculi in this patient? A. Increased intake of fluids. B. Decreased consumption of dietary calcium. C. Declined renal function. D. Increased loss of calcium from the skeletal system. Correct option, D. Increased loss of calcium from the skeletal system. In individuals with paraplegia, increased loss of calcium from the skeletal system is a significant factor. The absence of weight-bearing activities can cause demineralization of the bones, leading to increased calcium loss into the bloodstream. Subsequently, the kidneys filter this excess calcium, elevating the risk of calcium-based renal calculi, or kidney stones. Furthermore, the immobility associated with paraplegia can contribute to urinary stasis, which further increases the risk of stone formation.